Good afternoon or evening or morning, wherever you are in the world, ladies. Lovely to be here with you. And I just wanted to talk today about rapid transformational therapy because I get asked a lot, what is it? How does it work? And how can it help with premenstrual dysphoria? So I'm Natalie Ryan Hebert. I'm the one who founded this group here, and I also give therapy to women all over the world via the wonders of the internet with rapid transformational therapy. And I specialize in premenstrual dysphoria because I used to live with it myself, but I don't anymore. How can that be? So rapid transformational therapy sort of cured me. I don't like to use the word cure because my idea of premenstrual dysphoric disorder is probably a little different to the average person's. But what it does is that it allows you to go to the root and the cause and the reason for the pain that you're in emotionally today. So it was developed over 30 years by a woman named Marissa Peer, and if you Google her, you will find a lot about her, and on YouTube as well. I really recommend watching her talks. She is brilliant, and she trained me in her method. And as I trained with her, the premenstrual dysphoria just disappeared. So now I'm obviously very passionate about bringing this to more women because now I'm out of the fire. I'm not just going to run off. I need to run back into the fire and help others out too. So the way it works is that it uses hypnosis as the vehicle. But it's kind of like a super hypnotherapy because it uses hypnosis as the vehicle, but then it takes once the person is in hypnosis, once you're in touch with your subconscious mind, we use other methods like neuro-linguistic programming, CBT, inner child work, timeline therapy, Gestalt therapy, to undo the beliefs that you've formed that are still being triggered in you. So the reason it's so difficult for women with premenstrual dysphoria is, and I've said this before if you've watched some of my other videos, we have three things. We have a cycle. All women have that, mostly menstruating, a menstruation cycle. We have some sort of unprocessed trauma. Again, most people have that. But what sets women like you and me apart is we have this amazing sensitivity and empathy, and probably creativity too. This is what makes us a bit different. When you combine these things, you get premenstrual dysphoria premenstrually, because when the hormones shift, you get brought closer to, the facade thins, the veil thins, and whatever you've been able to hide the rest of the month sort of comes to the surface. And because you're highly sensitive, you feel it much more than the average would. And because there's trauma there, trauma means that you've created beliefs about yourself that are negative and limiting. The biggest one that I find in most of my clients is I'm not good enough. And because you have this belief, I'm not good enough, you feel you need to hide it away, and there's a mask there. Except the trouble is, well, not the trouble, but premenstrually, that mask becomes very thin. And this I'm not good enoughness, this makes you very insecure because you feel so exposed. And it doesn't take much to set you off, to make that pain in you react. So RTT allows you to go back to the root and the cause and the reason. We use regression, so you go back to the scenes. You don't have to do anything. Your subconscious mind will show you. Once you're in hypnosis, your subconscious shows you exactly. So once you're in hypnosis, I will ask, okay, so we're going to go back now to the root and the cause and the reason for why you, and I will name whatever the symptoms are that you have premenstrually. I never say why you have PMDD. PMDD is a label for what you're going through. It's different for every woman. Of course, the symptoms are very similar, but we've all got our unique box of pain that floods us, that comes to the surface. So we need to discover what's in that box, how it got there. Because what you discover when you go back in hypnotherapy, in RTT, is that the beliefs you've laid down about yourself were created by a 2-year-old or a 4-year-old or a baby. yourself when you'd only been on the planet for a few years, and you can create these beliefs in error. It's misunderstanding. The child's confused about something. I thought Mummy and Daddy loved me, but they've left me with this babysitter who I don't like. So that can only mean, and for a child, they can never come up with anything other than there's something wrong with me, or I've done something wrong, as example. And it can be things that you think, well, that's not traumatic, but to the child, it's what they interpret of it. It's what you interpret of the event as a child. It's what you start to believe about yourself that causes the trauma, not what happens to you. So in effect, it's your own wounding of yourself, because you stopped believing you're lovable. You start believing there's something wrong with me. And when you do that, you're splintered. And this is the pain you're carrying. So we need to make you aware of how this happened. And when you do that, you go back, you see your younger self, and you realize the error that you made. And you can go back and talk to that child that was you and explain to her, sweetheart, this wasn't anything to do with you. You're loved, you're beautiful, you're worthy, you're good enough. And as you do this, your inner child starts to get it and go, oh, is that why? So you save yourself. And then in saving your inner child and setting her beliefs straight, which are yours, you update your beliefs. And then she heals you. So that's how it works. It's a little tricky to explain it, but there's a lot on the internet about rapid transformational therapy that you can watch, and there's so many incredible stories of healing people with all sorts of issues, not just premenstrual dysphoria, but that's what I work on because I know it inside and out from myself, and I know what to do to get you beyond it. You just need to know at the deepest level of consciousness that you are enough. That's it. Isn't it simple? And when you know you're enough, you become bulletproof. And when your hormones shift, there's nothing in that box of pain to magnify anymore. You still have the cycle, you still have your sensitivity, but the trauma's healed. So there's nothing for the sensitivity to magnify. So I hope that sheds a little bit more light on how RTT works. But have a listen to the podcast on Mind Speak. If you want to look that up, it's on iTunes. I was interviewed last week. It came out, I think, with Holly Higgins, who is a fellow RTT practitioner. She specializes in nutrition as well for depression, anxiety. And we go much deeper into all of that in the podcast. So have a listen if you've got time. Chuck it on in the car, or if you're riding your bike somewhere, or just cleaning the house, you can listen to the podcast. So yes, that's all. But do ask questions in the comments below, and please take part in the group, ask questions, post articles, whatever you think could be useful, and then we can make this group even better. So thanks for listening, and reach out if there's anything. And you know that I offer a free virtual coffee chat sort of consultation to anyone in the world who wants to talk with me personally about their own life and ask questions about potentially working together. So you can just book that. I'll pop the link below here if you're interested in that. So enjoy your day wherever you are, and I'll catch you next time. Bye.